Good morning, everyone, and welcome to today's webinar. My name is Chelsea Smith. I am a Learning and Development Specialist here at Action Benefits, and today we are going to talk about some of the more nitty-gritty details of the Medicare expertise market. Joining me today, you know her, you love her, Debbie Brown. So Debbie, if you'd like to say something really quick before we get started.
Hello, everybody. Most of you know who I am. Hard to believe, but been doing this 16 years. So whatever Chelsea says, I'm going to back her up. And if you guys have any questions or concerns, you can always call the individual team and any one of us will help you out. Take it away, Chelsea.
Awesome. Thank you, lady. All right. So we got a lot to cover, so I'm just going to go ahead and get right into it. So today we are looking to talk about these three things within our session. We are hoping that by the end of the session, you will be able to identify special cases where a beneficiary can enroll in Medicare, describe how late enrollment penalties are calculated for the various parts of Medicare, and identify the ways which Medicare coexists with private carriers and public programs. Because as we know, Medicare does not stand alone every time. So let's start with talking about Medicare enrollments, how one can enroll in Medicare and when one can enroll in Medicare. Tongue twister there. So there are a few different times that beneficiaries can interact with Medicare. We're going to start all the way over here. I'm going to just put them all on the screen just because it's easier that way. Okay, so we'll start over here on the left in the initial enrollment period and move our way over. Hopefully I'm not mirrored, but we'll start all the way in the initial enrollment period. And this period refers to the 3 months of time before and after the beneficiary turns 65 and the month that of their birthday itself. So that means the total length of an IEP is 7 months, 3 months before their birthday, 3 months after their birthday, and then that month that their birthday occurs. During this period, beneficiaries can enroll in A and B and then move into enrolling into C and D after A and B is all covered. So we're going to talk about the rest of the periods later on, but let's focus right now on the IEP. So in some instances, an IEP will not be needed, though because the beneficiary might automatically be enrolled due to meeting some requirements that might cause you to be automatically enrolled. Those requirements can generally be boiled down to the person being able to receive Social Security benefits early for some reason or another, whether that be because they worked for the railroad and they earned those benefits early, or some sort of condition that allows them to sign up for Social Security early, like a disability or ALS. If you are collecting Social Security prior to turning age 65, you'll get Medicare automatically. Technically, that package is mailed out 3 months prior to that person's 65th birthday, just to cover that entire IEP, which means the beneficiary would have to be getting Social Security due to the disability or ALS for at least 4 months prior to turning 65 in order to be enrolled automatically. So not all of these are going to cover everyone, obviously. Most people don't get automatically enrolled, I would say, but there are some people who do get enrolled automatically. So many beneficiaries aren't automatically enrolled into Medicare, so they have to take active steps themselves to enroll by contacting Social Security 3 months before they turn 65. If they're diagnosed with ESRD, the IEP will begin for that beneficiary the month they are diagnosed with ESRD and lasts for 3 months after that diagnosis. So those are the two instances where you are not automatically enrolled in Medicare, and most people, I would say, probably fall into one of these two categories, probably the first category, approaching age 65 and not getting Social Security benefits. Okay, and that brings us to our first knowledge check, unless Debbie, you have anything you'd like to add before we continue?
Everybody kind of gets wrapped up thinking that anybody, once you turn 65, you get Social Security benefits. That's the way it was years ago. But now that most of us work past that age, unless you are taking your full Social Security benefits, you will not automatically automatically get Part A. And keep in mind, if you're on a group of over 20, you do not need to sign up. You can wait until you get those Social Security benefits. So other than that, take it away.
Perfect. All right, so this is our first question here. So in which of the following cases will a beneficiary need to take action to enroll in Medicare Part A and B? Most of us got the most common reason correct, not receiving Social Security benefits or railroad benefits and turning 65. That is the most common reason that someone would need to enroll in Medicare themselves. But we all slept on that ESRD at any age, right? The government is not going to know when you are diagnosed with ESRD. You will have to enroll in Medicare yourself if you are diagnosed with that for 3 months after the diagnoses and the month of the diagnoses. So don't forget that that is another reason that someone would be required to sign up for Medicare on their own and not be automatically enrolled. So next we have the general enrollment period. The general enrollment period takes place from January 1st through March 31st. This is the time where people who are eligible for Parts A and B but didn't get it when they were first eligible in their initial enrollment period are able to join. Some exceptions exist if the beneficiary qualifies for a special enrollment period, which we'll talk about in a second. But in most cases, enrollees have to pay late enrollment penalties, and coverage will begin on July 1st if they enroll during their general enrollment period. During this time, a Medicare Advantage plan cannot be selected. That is a different enrollment period. I'm sure you can guess on the screen which period that is, but every year, like we said, general enrollment periods take place from January 1st through March 31st. So this is kind of what the timeline would look like. You would enroll during that January 1st through March 31st if that person did not participate in their IEP. And then coverage will be effective. I'm sorry, I just said July 1st and I was incorrect there. The coverage will be available the first month after enrollment. I was incorrect. Scratch that July 1st thing. It was changed. It was changed. Okay, so next we have that special enrollment period, which starts whenever a beneficiary loses access to their employer-based coverage. This period lasts for 8 months after the coverage is terminated from losing that employer-based coverage. So once that IEP ends, beneficiaries may have the chance to sign up for Medicare during that special enrollment period that we talked about. If beneficiaries are covered under a group health plan and are currently employed, they have, because of their current employment, I should say, they have an SEP to sign up for Part A and Part B, or just Part B anytime, so long as they or their spouse are working, or they are covered by a group health plan through the employer or union based on that work. So usually if you had employer coverage and are switching to Medicare, and late enrollment penalty wouldn't apply. So if you have a person who would like to keep their employer coverage, work past 65, stay a couple more years, and don't want to pay 2 premiums, one for Medicare and one for their group health coverage, they are able to just keep that health coverage and not pay any enrollment penalties for Part B, so long as they keep that coverage maintained. So it is important to check the calendar when determining the effective date for Part D. In the best case scenario, the beneficiary will have no lapse in coverage and they won't incur a late enrollment penalty. And to do that, it's important to sign up 63 days after the loss of coverage. For example, if the member lost coverage April 15th, 2019, 63 days from that point would be June 16th. So that member would need to apply for Part D coverage in May to ensure that June 1st effective date and not have any lapse in their Part D coverage and not have to pay any of those penalties. So which of the following statements is true regarding general enrollment periods? Okay, so the correct answer here would be B. The period is designed for beneficiaries who have missed their IEP. So always encourage your clients to sign up for Parts A and B during their initial enrollment period if possible. And if that is not possible, if they don't have group coverage, I guess I should say, but if that's not possible and they're going to wait till a general enrollment period, that's going to be when they're going to sign up. It is designed for those who miss their IEP but don't have a special enrollment period. So next we have the annual enrollment period. This is the period for those who would like to change some aspects of their enrollment or who are already enrolled in parts A and B and would like to add C and D. So at Action, we like to think of this time period in general terms as a like plan transfer, even if it's not like a perfect metaphor for what exactly goes on during the annual enrollment period. But there's a lot of options that are similar, but not necessarily the same. So for example, you can change from original Medicare to a Medicare Advantage plan, or you can change from a Medicare Advantage plan back to original Medicare. So you can be switching back and forth between different types of plans that are kind of similar, but you can't be making huge leaps and changes in your plans. So I don't know.
Chelsea?
Yes.
I just want to interject there that during AEP, we could, a member can make any kind of plan change. It doesn't have to be a like change.
Right. Yes.
Yeah. So during this period, if they've never been in an enrollment and missed all the periods, and now they would just realize their health is changing, they need to make a plan change or add a Medicare Advantage, they can do that. If they had Humana, now they want to go to Blue Cross, or they had a HAP and they want to go to Humana, whatever. This is the time of year when they can start making those changes. It does not have to be a like change. So let's say somebody found out they had an MA only plan, they didn't have the drugs, they don't have VA insurance, they don't have nothing, and they got to get into a plan with a drug plan, then they can go to an MAPD during this period. So
yep, absolutely. Yes. You can change into a plan that doesn't offer drug coverage, or one that does offer drug coverage, vice versa. That is also an option as well. Yep. So we tend to just use that term a little bit. I don't particularly love it, but if you want to find one sentence to remember, I would that's where I would go. But exactly, it's not necessarily just a plan that's similar. Okay, so the next plan enrollment period we have is the MA open enrollment period. This is where you can enroll in your Part C's and make a one-time plan change. And this also occurs from January 1st through March 31st. So it lines up with that general enrollment period for you.
Yeah, and during this period, that's when you can only make like change plans. So if you had an MA plan, you can't go to an MAPD. If you have an MAPD, you cannot go to an MA. Those are the main things that you cannot do. So, and I know you have some of that written down here.
Nope,
I just wanted to confirm.
Yep. So this is more where you can do some of those more detailed changes that kind of relay with one another. So you can disenroll from a current MA or MAPD plan to enroll in a different MA or MAPD plan. You can return to original Medicare with or without a prescription drug plan. If you're enrolled in a Medicare Advantage plan during your IEP, you can change to another Medicare Advantage plan or go back to original Medicare within that first 3 months of having Medicare. But you can only do one change during this period, right? So we can't be flip-flopping all over the place. You got one change and that's it. But however, those who have original Medicare can't use this time to enroll in Medicare Advantage or an MAPD plan or make changes to their Part D. That's a totally different thing. What is the primary difference between the annual enrollment period and the Medicare Advantage open enrollment period? All right, so if you answered A, that beneficiaries have more flexibility during AEP, that is correct. There is more flexibility during that time to make different types of changes like Debbie had been talking about earlier. The OEP is kind of where you're a little more limited in where you can make those changes. So keep that in mind. as you are helping your clients get the coverage that they would like to switch to if they already have some of that coverage. So now we're going to hop into some stuff with end-stage renal disease. This has changed a little bit from 2022 to 2023. No changes that I'm aware of for 2024 with ESRD, but there were some changes last year made that you might not have ran into yet that you might want to be aware of in case you do see someone with ESRD between those time periods. So for individuals who are eligible for Medicare based on end-stage renal disease diagnoses, there are some special enrollment coordination details to be aware of. So let's follow a hypothetical journey of someone who is diagnosed with ESRD. So once a beneficiary begins dialysis treatments, a 3-month waiting period will begin. And this period will be waived if the enrollee meets 2 conditions. So if they participate in a home dialysis training program offered by Medicare approved training facilities during the first 3 months of regular course of dialysis, or if the doctor expects training to be finished and ability to do self-administered dialysis treatments will happen within that 3 months of time. So if those 2 things happen, then that 3-month waiting period is waived. Otherwise, the beneficiary with ESRD needs to wait before Medicare benefits start. During that first 3 months of treatments, a beneficiary's group health plan will continue providing that medical coverage. If that group plan is responsible for coverage during the first, I'm sorry, let me try that again. The group is responsible for coverage until that first day of month 4, when Medicare benefits kick in. And on that first day of month 4, a 30-month coordination period begins. During that time, the employer group health plan will continue paying for benefits as that primary payer. And Medicare may pay any remaining costs if they wind up with any as that secondary payer. And then that individual will lose eligibility 12 months after the last dialysis treatment occurs, or 36 months after a kidney transplant. However, coverage may be extended if that beneficiary resumes dialysis treatments or receives a transplant. And that coverage will be extended again if another transplant is received within 36 months of that first transplant. So basically, we're looking at whether or not that person was receiving transplants or whether or not that dialysis is going to stop to see whether or not that coverage would be extended. So another way that coverage can be extended for someone with ESRD is if they need immunosuppressive drugs. This was new last year, but I wanted to just emphasize it one more time in case someone did not have someone with ESRD and is not aware. So Part B will cover immunosuppressive drugs beyond the original 36 months if that person was offered or was previously offered after an organ transplant, or if the beneficiary has no other health coverage with an immunosuppressive benefit. This new benefit does reduce the premium. So if you're only catching that immunosuppressive benefits, you will only have to pay basically for those immunosuppressive benefits. But it's still based on your income and filing tax status. You'll still have to pay IRMA for it if you are qualified for IRMA. It does not qualify as full health coverage. And it only covers the immunosuppressive portions of care. Okay, so that's a little something to keep in your back pocket if you have a person who is diagnosed with ESRD and would need those immunosuppressive drugs. So a client of yours is diagnosed with ESRD and has begun dialysis treatments. The client is not currently covered by an employer group health plan. Which of the following statements are true? Alrighty, so if you answered A and B, you are correct. There will be a 3-month waiting period for Medicare to start covering things unless a doctor signs a notice saying that you meet those other 2 qualifications, or if that 3-month waiting period can be waived due to that self-administration of treatments, right? Okay, so let's keep on here. 2 late enrollment penalties for parts A and B and D. So as we learned about yesterday in our, if you were there for our basics of Medicare course, most of us don't end up paying for Part A because we worked. But if you didn't work, or if you didn't work long enough and you have to pay that Part A premium, you will also end up paying a late enrollment penalty for Part A premiums if you don't sign up on time. So beneficiaries can be subject to those late enrollment periods if they don't sign up on time. For Part A, this penalty only applies if the person doesn't sign up during IEP and doesn't qualify for that premium-free Part A, like we talked about. The penalty is calculated by adding a 10% fee to the base premium each month, and the penalty is charged for double the amount of time the beneficiary was supposed to be enrolled but wasn't. So if a beneficiary waited a year to sign up for Part A, after their initial enrollment period, they'd pay 10% more for Part A for 24 months because they waited 1 year. So you pay that 10% more for 2 years until you pay that all off, and then you get to pay the regular premium again. But like I said, most of us won't end up paying for that anyway. So in 2023, the Part A premium for a person who has worked 30 quarters of Medicare covered employment was $506 a month. There's no estimates for 2024 quite yet, so we're just going to work with the 2023 numbers. Those who had between 30 and 39 quarters of coverage would buy Part A at a reduced monthly premium rate, which would have been $278 for 2023. So late enrollment penalties for Part A and Part B, there is a little bit of a difference. Both of them do have late enrollment penalties. For Part A, like we said, it's on the screen there, but for Part B, it's a little different. Most of the time it does apply if you don't enroll during your IEP, unless you had one of those SEPs because you lost employer group coverage. If you're going to pay that Part B late enrollment penalty, it will be 10% increase added to the premium that you would pay for each 12-month period that enrollment was delayed. And that penalty will stay in place as long as the beneficiary is enrolled in Part B. So it's a lifetime penalty. So Part B especially, enroll in that if you're on time during your IEP, if you are looking to avoid those penalties, or if that person gets an SEP, a little different. So let's look at an example here. Opal enrolled in had an initial enrollment period, I should say, in December of 2019. She waited to sign up for Part B until March of 2022 during her GEP, or during a GEP, I should say. Her coverage then would have started April 1st, 2022. And Part B premium penalty is 20% of the standard premium and will have to be paid as long as Opal keeps Part B. So even though she isn't covered for that total 27 months, it rounds down to the fullest 12-month period. So she would only do 2 years because it rounds down to 24 off of that 27. Okay, so late enrollment penalties, all three. We have Part A, Part B. Now let's look at Part D, late enrollment penalties. So same thing, you get that late enrollment penalty if you don't sign up when you were first eligible. If that gap from coverage is not there for, if that gap in coverage is longer than 63 days. It's determined by multiplying that 1% of the national base premium by the number of months that the beneficiary went uncovered, and then rounded to the nearest dime. That amount is then added to that monthly premium. That penalty stays in place for as long as beneficiaries are enrolled. So the reason we don't have one specific number is because everyone's premium for Part D is going to be different, right? Depending on what plan that person chooses. So for example, when a person joins a Medicare drug plan, that plan will review Medicare systems to see if the person has a potential break in credible coverage for 63 days or more in a row. If so, the Medicare drug plan will send a person a notice asking for information about prior prescription drug coverage. It's imperative. It is so important that that person fills that form out and completes it and returns it by the date on that form, because that's the person's last chance to let the plan know about that prior health coverage that Medicare might not have been aware of. Because if they didn't have that prior coverage, they're going to end up paying that late enrollment penalty. And if you want to keep that late enrollment penalty at bay, you're going to want to fill out that form and avoid it that way. So we have this example here on the screen. Tarek is currently eligible for Medicare, and his IEP ended May 31st, 2019. He doesn't have any prescription drug coverage from any other source, and he didn't join by May 31st, 2019, and instead joined during the open enrollment period that ended December 7th, 2021, and his drug coverage was effective January 1st, 2022. So since Tariq was without credible prescription drug coverage from June 21 to December 22, his penalty is applied in 2022 when he starts coverage. So Tariq's new monthly penalty in 2022 is 31% of 3306, or if you do the math, it's 1025 a month. And since that monthly penalty is always rounded down to the nearest 10 cents, he pays, rounded to the nearest 10 cents. He pays $10.30 each month in addition to his plan's monthly premium. So if you take a look at the math there, this is what it would look like. So 31% of the penalty times that $33, you get his late enrollment penalty. Add that to his premium, that's how much he's going to pay. And then this would be refigured again in 2023 because it changes yearly. So I'm not going to read all of it to you again, but it is changed based on how much the monthly premium for his drug coverage would have been times that 31% penalty, add that in, new monthly premium. And this will go on for the rest of the time that Tariq is in that coverage. Okay, so there's our summary of our late enrollment penalties. One more time, remember Part A is 10% increase to the monthly premium, and that penalty stays in place for twice the number of years that he was enrolled, but the enrollment was delayed. So that does end eventually. For Part B, 10% increase to the premium for each year that the person delayed enrollment, and that penalty stays in place for the entire time that they're on Part B. And then Part D is either not enrolled at first, or a gap in their coverage goes for 63 days or longer. A 1% national base premium is multiplied and then rounded to the nearest dime, and then that is added in. So let's head into our next knowledge check. In most cases, the only late enrollment penalty that will end while the beneficiary is enrolled in Medicare is which of these three? So yes, this was a quick one for us. Yes, the Part A is the only penalty that can end while the person is still enrolled. The other ones are lifetime penalties. All right, so now let's hop into those supplemental plans and how we can enroll in those. So when someone applies for a supplement policy, they are either applying within a guaranteed issue period or a non-guaranteed issue period. And what that means is that depending on which period the beneficiary applies will determine if the beneficiary will have to undergo medical underwriting, and the prices within their policy might change if certain medical conditions appear within that underwriting. They may also be denied coverage completely if applying outside of a guaranteed issue period. But if that beneficiary applies within the 6-month window that they get when they first are able to apply for it, they experience that guaranteed issue, and none of those factors will apply. They are not able to be denied coverage based on medical conditions, or because of nor can the price of that policy change because of that underwriting. So if you have a client that is worried about that medical underwriting process, if they have some sort of pre-existing condition, something like that, it's a really good idea to have them enroll in that MedSup plan during that open enrollment period if they have their heart set on a specific plan. to make sure that they're paying the price they want, or to make sure they're not excluded from that plan. But if they wait a while and they are outside of guaranteed issue, it might be more expensive, or it might not be an option at all. This is a fun one. So coordination of benefits refers to the way that Medicare and another insurance a person might have, such as their group plan, Medicaid, ESRD plans, veteran care, whatever, could interact with one another. If you have Medicare and another type of health coverage, each type of coverage is called a payer. And when there's more than one payer, coordination of benefit rules will decide which one pays first. Medicare may be the primary payer or the secondary payer, depending on which one it is trying to play with. And it depends on the circumstances, right? There might be a situation where Medicare pays nothing. There might be a situation where Medicare pays everything. There might be a situation where Medicare pays a part. And that all depends on which other type of payer they are playing with. So I'm not going to read this entire chart to you, but it does depict some of the ways that different types of plans can coexist with Medicare. Retiree coverage, group health plans, under 65. But I will say that the most important thing to remember in this chart is that if an employer group health plan has more than 20 employees, that Medicare is a secondary payer. So the same is true for a person who's under 65 and disabled, but still enrolled in employer group health plans, right? So if there's less than 20 employees, then Medicare does pay primary. So if any of you are familiar with the rules regarding COBRA, same thing as that 20 employee mark is important here as well to determine who pays first. Otherwise, it's just kind of what's in the chart. And remember as well, if you are enrolled in Medicare, it is not possible for you to have a marketplace plan, so those can't interact with each other. All right, so another knowledge check. I know I'm hitting you with a lot of knowledge checks today. Unless Debbie, you have anything you'd like to add?
Anyways, just to confirm with what you're saying, a lot of agents call, people try to get out of getting on Medicare when the group is under 20. It is so important to guide your clients correctly. They need to get on A and B. Blue Cross isn't going to enforce it, but you're going to have claim issues. You're going to get Medicare demand letters down the road. So it's very important, if that group falls under 20 full-time and part-time employees, to advise your clients to get Medicare Part A and B. I know when they go to sign up, they get asked, do you work? But that person in Medicare doesn't ask, is that group under 20 or over 20? That is the important question. They have to say, my group is under 20. I need to enroll in Part A and B. Very important. Very important. So you want to prevent any penalties of whatsoever for that member. So just an FYI.
All right, so those of you who might be in here who might also work in group, make sure you're telling your groups if they're under 20 to get on that so that they don't have any problems. It's going to be on the beneficiary at the end of the day, but make sure those groups know that too. So let's hop into this knowledge check. Hector, who's 64 and 9 months, is employed with a small 8-person web design firm. He is enrolled in the firm's group health plan and will enroll in original Medicare during his initial enrollment period. He intends to continue working until he is 70. Which of the following statements will be true regarding Hector's medical coverage? So yes, we all got this one correct. Awesome. So Medicare would pay primary here. Normally, if someone has, like we just were talking about, an employer group health plan, that plan is the first payer, the primary payer. But because this is such a small group, it's only 8. That's considered a small group, under 20 people. For the purposes of what we're doing here, it is a small group and it is under 20. So we would need Medicare to pay primary for Hector. So let's hop into veterans coverage really quick. I like to just have it all up just so you can see. So while some veterans might see the Part B premium as a burden, the VA does recommend, that vets do enroll in A and B when they turn 65. Depending on that vet situation, they might want to have an option to attend civilian hospitals or see a civilian doctor. And they may do so if they are enrolled in A and B. That's not generally not possible for them to do if they are a veteran without A and B. Some might not have a desire for that option depending on what their options are where they live, right? We were just talking about this in a meeting the other day. Some vets love their VA benefits, would go to VA doctors, have no desire to go see a civilian doctor. Some, depending on their area, would live and die to get that Part B and see not a civilian doctor. It just depends on that person in that area. It's up to that vet what they want to do. But if they have that desire, they will want to sign up in Parts A and B. And VA coverage as well, it's important to remember, it doesn't protect that vet from any late enrollment penalties. So if a vet thinks they might be interested in Part B at any point or in the future, it might be advantageous to sign up when eligible to avoid the penalty. Just keeping that in mind. I will say though that for Part D, VA coverage does count as credible coverage, so that 63 days, of lapse of Part D coverage would not apply if that person has VA benefits. It is considered credible coverage. TRICARE is a little different. TRICARE, who pays first, is affected by what services are covered by what entity. So if the service is covered by both TRICARE and Medicare, Medicare would pay first, then TRICARE would step in after if necessary. If the service is only covered by one entity, then that entity would pay, and the other entities take a break and do nothing. So if it is something that only Medicare covers, only Medicare will pay. If it's something that TRICARE only covers, only TRICARE will pay. Yes, this is the last one. So let's end strong, guys. All right, so Joseph, 89, is a veteran enrolled in Original Medicare, TRICARE for life, and VA benefits. He is hospitalized in a non-VA facility for a condition not related to his military service. What is true about the Medicare covered care that he's going to receive? That Medicare would be the primary payer in this situation, and then TRICARE would act as a secondary payer. It would pay anything left over if that was the case. So Medicare and COBRA. All right, so COBRA requires employers with 20 or more employees to let employees and their dependents keep their health coverage for a period of time after they leave their employer group health plan. This is called COBRA continuation coverage. The law applies to private sector plans and state and local government sponsored plans. Spouses and dependents can stay covered for up to 3 years if they lose eligibility for coverage due to death of the covered employee, if an adult child turns 26 and ages out of the parent's plan, due to a divorce or legal separation from the covered spouse, or if the covered employee becomes eligible for Medicare. So there's not going to necessarily be a need for that employee to kick their spouse or dependents off of their health coverage if they turn 65 and would like to join Medicare. That those family members can choose to enroll in COBRA at that point if they would like to. Remember, it's not going to cost the same, probably, but that is an option. This is a flow chart that would describe the process by which COBRA and Medicare can interact. I'm not going to read the whole chart to you. You can look at it. I highly, highly, highly recommend if you have additional questions about COBRA and Medicare, because there's a lot of different nitty-gritty details how COBRA and Medicare would interact, depending on if the person has ESRD or not, depending on if the person has group coverage and COBRA, or I'm sorry, group and Medicare, whether or not the person disenrolls in Medicare and the dependents are involved. There's a whole lot of different things that can come into play here. So I would check out, there's videos on YouTube that someone made called Medicare in Minutes, and they talk about a lot of the different nitty-gritty details of aspects of Medicare that might not have been covered in this presentation or would be covered in more detail. And check out those videos. They're awesome. They're updated every year. So once CMS puts out those numbers for this year, those videos will be updated too. Oh my gosh, they're waiting so long, guys. They're waiting so long. So let me wrap up some key takeaways before I let you go today. So hopefully now, after watching this webinar and hanging out with me, you can identify some special cases where a beneficiary can enroll in Medicare, describe how late enrollment penalties are calculated for the various parts of Medicare, and identify the ways that Medicare coexists with private carriers and public programs. So if you want to save anything from today, I would recommend saving the 3 slides I'm about to show you. If you know how to screenshot, or if you want to take a picture with your phone, I would take a picture of this slide because it illustrates all of the enrollment periods, all of the ways that your clients will have avenues to enroll in Medicare. The next one I would say to hit up is the summary of late enrollment penalty slide. So here's all 3 of the parts that do have late enrollment penalties attached and how they are calculated, because they are calculated similarly, but not the same. Each one is a little different, like we talked about before. And it would be a great idea to have all that information available to you in one spot. Here it is. Take a screenshot of that for yourself. And then our last one is the coexistence and coordination of benefits chart. For those of us who might have some beneficiaries who might keep their group health plan, or be dual enrolled with a retiree coverage and Medicare, or maybe Medicaid, Medicare, or something like that. If you need to know those things, this would be the place to gather that information. And with 2 minutes to spare, that is all the information that I have for you today. You have my attention now, but if you have any other questions, you can email your account manager, email me, email Debbie. Debbie, is there anything you would like to close out with, or?
No, but once again, like Chelsea said, the individual team is here for you. If you have any questions, you can email anything for Medicare or under 65 to individual@actionbenefits.com. We're here to help you and get out there, make some money, and sell, sell, sell. Thank you.